Hi, everyone in the fire service. Dr. Jim Augustin, little weekly doc talk, talking about COVID. Thanks for taking your time. Last week, we talked very broadly about COVID, the new version of it, which is called the Delta variant, the need for vaccines. And this week, as we come off of Labor Day, a lot of new topics going on relevant to the fire service. First and most importantly is we have never had a higher death count in the fire service than we've had over the past couple of weeks. This is getting very depressing because as I read the briefs that are coming out from fallen firefighters, from the general media, and from our internal news links, we've never had as many deaths in the service as are occurring right now. And unfortunately, the pace is picking up rather than going down. This week, we buried one of our firefighters in one of my services in the Atlanta, Georgia area. A young guy with children who got very ill. As typical, he had no underlying medical problems of significance, but he got one of these terrible courses and died. Our firefighter's devastated, trying to help his family. Just so you know, that is a responsibility that we all have, is to help the survivors. And that includes our own department members as well as his family. We also are having unprecedented death counts in the rest of public safety, which is EMS workers and law enforcement. And one of my law enforcement agencies lost 3 members in the last 10 days. So imagine how that service is having to deal with it. So what are we going to do about this? Number one, we're clearly at the point around the country now where it is necessary for us to use universal precautions. And so that's an N95 at minimum in our patient encounters, avoiding multiple people being exposed, using fresh air as much as possible, using social distancing whenever possible. So back to what we discussed in March of 2020, a year ago, about a scout individual going in to take care, do the initial history, not using unnecessary equipment within 6 feet of the patient. That scout only calls in additional people that are helped if they're really needed. Explaining to the patient, because it's always about customer service with us, exactly what we're doing and why we're doing it, and that what we're doing is for the safety of the patient, because sometimes the patients are concerned that we're going to give something to them. Number 2, anything that we can do to keep spread occurring from within our fire department families, really important. If you're ill, don't come to work. Wash your hands regularly. Social distance when possible, even within the station. Wear a mask within the stations. And many of you have rules in place related to that. Avoiding unnecessary internal exposures to the public and when out, whether it's getting our food for the day, interacting at a fire scene, et cetera. And then I'm going to remind again, as we're heading into this fall season, a really timely topic is we're into allergy season, we're into other respiratory diseases. Please don't come to work sick. And think that it's nothing and then spread an infection, whether it's COVID or something else, within our stations and within our members. Number 3, really important point, the vaccinations still available. As evidence is coming in, they are proving even safer. So the last 2 weeks, 2 studies, one on men. What are sperm counts in men post-vaccination? Actually, in the groups that were studied, sperm counts pre-vaccination to post-vaccination went up. No evidence of any impairment of either the volume of sperm or the quality of the sperm. And so a really scientific study, but I have to be that precise. Number 2, in women, what is the risk of spontaneous abortion, miscarriage after vaccine? A very well done study published today in our biggest medical journal says no increase in miscarriages following vaccination. That's really important. And for our female members of the service, worried about either the ability to get pregnant or to carry the pregnancy. In neither case is there any evidence. What we do know is for males and females and young and old, that COVID has a lot of long-term repercussions and has devastating effects on people when they do get the infection. So anything we can do to prevent the infection to begin with is really important. And so far, the vaccinations are proving very safe. And now in doses given hundreds of millions of times across the country and across the globe, our vaccinations are proving safe and effective. Can't ask for anything more than that. In discussing vaccine safety, so my career, I began with my parents worried about me getting smallpox and polio. I was in the generation that early on got the vaccines. Here's my smallpox scar from them at the end of that era, having to get rid of a terrible, fatal disease called smallpox. Fortunately, my generation took all these big shots and we eliminated smallpox essentially from the planet, except in research labs. Number two, polio was still crippling kids in my age bracket. And I went to school with kids who were in braces and some who died related to polio early in their years. We early on had only shots to eradicate polio. And then as time went on, we got down to drops and sugar cubes. And so later generations after me had the benefit of us going through the shot version before they got to the drops on sugar cubes. Just so everybody knows, across the planet now, there are research studies on COVID vaccinations that will be either nasal sprays or drops in the mouth and may prove to be safe and effective. Boy, for those that don't like needles like me, that will be a big advance. And I'm very thankful that researchers are beginning that work. But for now, we have to deal with this like we dealt with polio, and we have essentially eradicated polio from the planet. For our service, nothing more important killing people early in my career than hepatitis B, bloodborne pathogen. I came in the service in the days when we really didn't even wear gloves, and we dealt with bloody people all the time. And both in my role as an emergency physician in the emergency department and in the field, we got really bloody. And members in my age group got hepatitis B and suffered long-term consequences of that, including frequent deaths. What did we do? We developed a vaccine and a booster. And now every member who comes into the service get that very important vaccine, and we wear gloves and we protect our eyes and our face when we're around people who may be spewing blood for whatever reason. Really important. And now our members don't even think about hepatitis B because we've developed the discipline of getting the vaccine, getting the boosters. Every once in a while we get checked to see if our titers are still high. But we haven't dealt with a case of hepatitis B in 20 years in any of my services. Thank goodness. A real killer and a very sad and painful way for people to live their lives or to die. So vaccines, long reputation in our industry, really good. We have a new disease to deal with. We have a safe, effective set of vaccines. By wintertime, I'm going to tell you, there will be 5 vaccines available in this country. And so there will be choices that people can take. I will keep you up to date, I promise you, as the choices come about and what the new AstraZeneca and Novartis vaccines may mean for you and options available. So 5 vaccines, the early 2, Moderna and Pfizer. The Pfizer just fully approved by the FDA, the Moderna next in the process. And right now, the important research going on for your children or your grandchildren in the service. We got to get this down to age 6 and then down to age 2 and proven safe and effective in that age group so that we can even further reduce the incidence of COVID in the country as we go through this wave. So today, the administration is going to announce some changes in the booster program that they announced earlier. Turns out they were a little premature in giving some early information about boosters. Next week, I promise you more information about boosters. For this week, be aware that early vaccination series is really the most important thing for us in the service. Number two, protection as we go through this very devastating wave of coronavirus. So everyone stay safe. Enjoy our fall time. Protect yourself from the allergies that are going to happen next. Stay safe in the station. Thank you all for what you do.